CBS 17 News, tracking coronavirus.
We're making a real difference in banning these mass gatherings and changing people's lifestyles, which I think is a matter of life and death.
Governor Roy Cooper addressing the state's battle against the coronavirus. We'll hear more from the governor in just a minute.
But first, here are the latest numbers. There are now 1,584 cases in North Carolina. Also, we've learned Macon County is reporting its first COVID-19 case. State health officials report a total of 10 deaths. 204 people are in the hospital, and 26,243 tests have been completed. North Carolina, like the rest of the country, struggling to get the supplies we need to deal with the COVID-19 pandemic.
Now, the latest models show the state's hospitals likely to see a surge of patients over the next few weeks. CBS 17's Capitol reporter Michael Hyland spoke one-on-one with Governor Cooper today about how the state is managing this crisis.
Governor Cooper, thank you so much for taking the time to join us here and tell us about what you're doing to respond to the coronavirus. I want to start by asking you about what are the most immediate needs at this point as we approach this surge we're expecting in our hospitals. Are we even going to have enough beds for all of the patients that we're expecting? We
are continuing these interventions because we don't want to run out of hospital beds and ICU beds. We know a surge is coming. This is why we've asked our hospitals to stop elective surgeries. A lot of beds have been freed up. We are also making plans to have additional healthcare facilities if we need them. We've asked the hospitals to surge and increase the number of beds that they have. Our number one priority right now is to make sure everyone who gets sick with coronavirus gets proper medical care in the right kind of setting. Obviously, we need a lot of personal protection equipment and supplies that we're trying to scramble to get all over the marketplace right now. We've only received 17.6% of the supplies that we requested from the national stockpile. So we're in the position of every state in the country of being out on the open marketplace to buy supplies and equipment that we know we're going to need for this coming surge. But we have a plan in place. We're working hard to make sure that we are ready, and we're asking people to stay home as much as possible, practice social distancing.
One thing that we've heard from so many people about is this issue they're having with the unemployment benefits. The website is simply not working. What are you all doing to fix that? And is this going to cause some people not to get their payments that they should be getting?
I've been pushing them every single day. My administration has. They've gotten new servers that are being put in place. They've contracted with another call center to help deal with the volume of calls. I ask people to keep trying, to keep pushing, because they're really ramping up to try to meet the need that is there. We've never seen anything like this at the volume that we've seen.
For everybody who applied during that first week and does qualify, should they expect to get those payments this week?
Yes, they should. And payments have already started going out. There are a lot of complexities with unemployment that we've been able to do away with a number of the regulations that slows down people getting money under the law, which is a positive thing. But still there is a 10-day waiting period for the employer to respond, those kinds of things that cannot be waived. But they're working hard to fulfill these applications.
With the funding that's coming from the federal government, I've talked to people who run small businesses, people who rent their apartments, who are glad that that money's coming, but it could still be weeks away before people have the cash in their hands. Do you think the General Assembly needs to come back, and do you all need to take some more immediate action to help people get through this point where bills are coming due today?
Well, we know that this federal money will help, and there's nothing that the General Assembly can do right now to speed up that process. I do know that I'm talking with legislators on both sides of the aisle to make sure that we can supplement what the federal government is doing. We also have a program for small businesses that is run through the North Carolina Rural Center, where money is coming from the Golden Leaf Foundation, which I think will be very helpful to small businesses. We want to push this process of getting as much money to people as possible. For example, we believe that by next week we can get that extra $600 a week into people's unemployment checks. And when we know exactly what the federal government has done, we'll come back in a General Assembly session when we all agree on a package to be able to move that forward.
With the stay-at-home order being in effect now, we still have seen some groups out. We've seen people ignoring the closed signs at state parks. Do you think there needs to be any greater enforcement of the stay-at-home order on a law enforcement side?
You can transmit it to a loved one if you don't obey social distancing. You could become sick yourself. So we're asking every single person to remember that when you're in close contact with somebody, you can either contract the virus from them, or if you have it, even though you don't know it, you could give it to someone that you love. We hope that people will comply with this order. I've talked with local law enforcement. They understand now that they have enforcement authority. What a lot of them are doing is already encouraging people when they see someone that may be standing around in a group and not doing anything in particular. Law enforcement is going up and talking to them and telling them how important it is for them to get home or to get to work and to stop standing so close to each other, because nobody's immune to this virus. There is no vaccination. The only way that we can slow the spread of this virus is to get people apart from each other and practice this new social distancing. And a lot of people's lives have changed. I think more and more people are beginning to realize the seriousness of this. If we have to continue to ratchet up the order to make things more restrictive, we will do so when the healthcare professionals tell us that's something that we need to do.
All right, Governor, thank you very much for your time. We appreciate it.
Thank you, Michael.